Are we playing, Firoz? No. Are we playing, Firoz? Hello and welcome to Health Live at Seniors Today. Today we are doing a special session because it's World Tuberculosis Day tomorrow. And we decided to invite Dr. Anita Mathew, who's Director Internal Medicine at the Fortis Hospital, which is in Mulund in Mumbai. Before I say welcome to her, I will introduce her. Dr. Mathew is, as I mentioned, Director Internal Medicine at Fortis in Mumbai, with many years of dedicated service in internal medicine, especially in the treatment of patients with infectious diseases, including COVID-19. Her deep understanding of the varied spectrum of health conditions afflicting different organs and the challenging field of infectious disease has often seen her help delicate immunocompromised patients combat life-threatening infections such as tuberculosis, hepatitis C, and certain forms of pneumonia. Her comprehensive knowledge of internal medicine and the complex, often chronic nature of the health conditions has put her in the league of top physicians in the city. Her excellence in a vast experience of handling a broad range of long-term conditions at Fortis Mulund is evident in her diagnosis and her approach to the treatment modality. Armed with proficiency in the diagnosis and treatment of all health conditions afflicting different organs, including cancers, Dr. Mathew is a revered name amongst her counterparts and medical students, tutors at Mumbai University. She underwent rigorous training in Thailand in the domain of HIV/AIDS, one of the most long-term infectious diseases afflicting mankind. Welcome to Health Live at Seniors Today, Dr. Mathew.
Thank you so much for the kind introduction.
Dr. Mathew, it's World Tuberculosis Day tomorrow, and before we request you to make your presentation and address our attendees here, tell me how serious is tuberculosis as a disease today, especially among seniors?
So tuberculosis has always been one of the concern points for us right from the time that we were medical students. So if you look at the graph, we have only seen a rise in the number of tuberculosis cases from the time that we have been students to today, maybe 33 years, 34 years later, when we work as consultants, the number has only progressively increased. It's only in the last couple of years that we have seen a real change in the kind of TB programs that we have in our country to kind of rein in this particular disease. And it causes a huge lot of morbidity. Morbidity for us is reduction in the quality of life and a good amount of mortality, wherein we have lost a lot of youngsters as well as elderly folks, the two age groups, wherein your immune system doesn't work to the optimum. So in that sense, it's a completely curable disease which we can easily control, but we need a lot of resources, not just from the governmental sector, the healthcare sector, but also from people to keep this disease, at bay, or at least have a reduction in the number of cases that we are seeing in the country. So in the elderly population, of course, it's been an increasing trend in the last couple of years, barring the last year, which has been a little better than before.
Ahead of this program session today, I've got a lot of questions already which have come in because there are some people who could not attend, and I'm going to raise these. But some of the issues that were raised are just the whole thing of why is the treatment process so long? Why does it take so long?
Because it's a bacteria which takes a long time to increased from 1 to 2. So if you look at the any other infection, let's say, for example, a malaria. So if you have a mosquito which comes and bites you today, the malarial parasite enters the body, it starts replicating at a rapid pace. So by the time all of us in our country probably are at the age of 5, we already have the bug of TB in our body. It's our immune system which keeps it at bay by allowing us to fight it out. So it's an immune related mechanism. So the amount of years that might take for you to actually manifest as a disease may be a couple of years, and you will never be in a position to say that you have cleared 100% of the bacteria out of the body by giving the treatment. So in the first 15 days itself, you would be able to reduce the burden of the disease, but the rest of the time point that is taken is to kind of reduce it back to maybe about 1 or 2 bacilli, which should not be able to harm you. So that's the reason that it takes a long time.
Yeah, I can imagine. So, Doctor, over to you for your presentation. And
yeah.
All of you over here. Yeah, sorry.
A very good evening to everyone here.
Yeah, we can see it. Thanks.
Just a minute. It's that visible?
Yeah, it's visible. Yeah. Thanks.
Yeah. Good evening, and I'll thank the organizers for having me here today, and a warm welcome to all the viewers. So the topic on the occasion of the World Tuberculosis Day is tuberculosis in elderly. So this is where we are in terms of the problem. India is one of the highest tuberculosis burden country in the world. We account for actually 25% of the global TB. In 2022, which was a milestone year, which is what I said, it's been pretty much okay in the last year as compared to before. We had the TB surveillance efforts in India, which had a record notification of 24.2 lakh cases, an increase of 13% as compared to 2021. Now, mind you, we did not have a robust program earlier wherein we were capturing all the TB patients. It's not to say that we must be capturing all of them right now, but we certainly are looking at more number of cases that we are picking up now and reporting to the government as against what it used to be done in the past. This translates to a case notification rate of 172 cases per lakh of population. We have a huge burden of multi-drug resistant TB in our country. The last year, we had about 63,000 patients who were diagnosed with MDR or rifampicin resistant tuberculosis. We are in a slow progress of undergoing a demographic transition. That means we also have an increasing burden of population, which is elderly, so above the age of 60. So what we could call a senior citizen, I wouldn't be calling them as really elderly. That's only by definition. And these numbers are only going to grow more because we have a huge number of population which is going to go into that particular direction. The persistence of this tuberculosis in this particular age group also is an important factor for us to say that our younger population also might get infected from us, and we are the pool of infection for that particular community. So it is important to see that we have lesser number of cases, both for our own health and for the health of our future citizens of India. So the older TB patients that we have among the pool of whatever numbers that we have as of now is about 10 to 15%, of which 50% of these are known to be sputum positive. Sputum is our the secretions that we produce when we cough out. It's not saliva, it's the cough that you need to get out. So what we typically call as cough is basically a reflux. What you bring out is phlegm or sputum. They have 40% higher risk of unfavorable outcomes because of tuberculosis. When I say unfavorable, these are basically, as I said, morbidity and mortality, which I just kind of defined a little earlier as the quality of life and the suffering vis-a-vis death, which is morbidity. So more than, if your age is more than 70 years of age, if you are a male as compared to a female, you are likely to have a higher risk of an unfavorable outcome. In patients who have already had tuberculosis in the past, and this is a relapse, then in that case, where these are called as retreatment patients, these are again going to be at a worse risk as compared to another counterpart without this. And those who have received at certain time point in future, or rather in the past, a direct observation therapy. So till maybe 5 years back, the government program was such that we had what we call as a DOTS therapy, wherein a patient had to go to the center, take the medication from there, for a period of 3 days in a week. That's all that was required. And this actually increased the risk of multi-drug resistant tuberculosis in the country. So people who have had that in the past are probably a little more likely to have a worse outcome than the other peer group. So why is it that the tuberculosis in elderly is a concern? One of the reasons for us is comorbidities. That means a patient who is elderly is more likely to have other diseases as well alongside with tuberculosis. So that itself will increase your risk of complications. So as we grow older, there are changes which occur within the body, which is called as physiological changes, and there are changes which happen at the cellular level, that is at the level of the cell, called as the molecular changes. So these both are responsible for our lungs also to have a persistent low-grade inflammatory stage, and also to cause a oxidative stage. So you would have heard that we always tell you to take an antioxidant. So vitamin C and vitamin E and all of these are antioxidants that we take. But these there are mechanisms in the body by which the inflammation can produce an oxidative stress, and this itself can cause the lung to get more weaker. Also, as we grow older, we look at what we call as immunosenescence. That means we are not growing old just by outward appearance. We are also growing old internally, and we are also growing old within our immune system. So this is a dysfunction of the immune system, which we cannot really halt. So this also increases the risk of tuberculosis and its reactivation. Diabetes, as you grow older, there's a higher incidence of diabetes. Diabetes by itself increases the risk of TB by about more than 1.5-fold. People who are chronic smokers, people who are chronic asthmatics, people who are having lung damage called as bronchiectasis, these are the groups wherein the risk of TB is high. Undernutrition, there are many senior citizens in our country who probably may not be having as a good amount of nutrition as they should at that particular age. And when I say undernutrition, it is basically both over and under, which would be a problem, because overnutrition, that is weight gain itself, will be one of the predisposing factors for diabetes, therein increasing the risk of tuberculosis. Undernutrition is when you are not able to get your sustenance in the form of good amount of protein, good amount of good carbohydrates and fats. All of these will also increase your risk of tuberculosis. People with immunocompromised conditions. So these could be patients with cancer, patients who are on treatment for autoimmune disease, and patients of HIV/AIDS. All of these are again comorbidities which increase the risk of tuberculosis. So, and of course, what I forgot to mention is alcohol abuse also increases the risk of TB. So what are the clinical presentation? Not too varied as compared to adults or to younger age group, but we need to understand at both the extremes of age, when people are really old and when people are very young in the age, that is in infancy or in early childhood, less than 5 years of age, your immune system is not capable of handling an infection too well. So you may not have fever as one of the major symptoms. So the typical TB symptoms, as what is popularly known as prolonged cough, bringing out blood and sputum, called as hemoptysis, night sweats, which is just having a lot of sweating in the middle of the night, chills, fatigue, a drop in appetite. These are less common in patients who are elderly as compared to the ones who are probably in the younger age group, less than let's say 15 to 45. TB lung lesions are usually misdiagnosed as pneumonia in a lot of patients who are in this particular age group as well. And it's only as the disease progresses that it is being picked up. We do know about TB of the lung. That's something that most of us are aware of. But what we also need to understand is there's something called as extrapulmonary tuberculosis. That means TB, which is in the other organs other than the lung. So you would have heard of probably tuberculosis of the lymph node. You can have tuberculosis pertaining to the eye, to the ear, to the skin, to the abdomen, to the certain organs, like in women, genitourinary tract. All of these can get affected by tuberculosis. So the symptoms which are pertaining to extrapulmonary tuberculosis will be dependent on the organ that it has affected. Disseminated TB, which is something wherein the TB spreads normally with the help of the sputum which you have. So it's a lung which allows it to spread. But if your immune system has been absolutely not in a position to control it, then it can spread by blood, which is what we call as disseminated TB, which is really the worst form that you can have, wherein the TB is studied in every single organ, and the chances of the patient succumbing in this particular situation is extremely high. Now, because of the comorbidities, we do understand that tuberculosis in elderly is more of a challenge in terms of how to manage, because you have multiple medications that could be ongoing for other conditions, which also would interact with the TB routine medication. So how would you diagnose these? One of the things that we have been doing proactively now is to do what we call as a tuberculin skin test, or IGRA, which is a blood test. Now, these are, mind you, for patients to pick up if they are having a latent TB. More often than not, most of the Indian population will have this test positive, but you need to go ahead and treat only if there are an immediate family member who is suffering from an active tuberculosis. Now, there is no gold standard to really detect a latent TB in elderly, but this is one of the tests that can be really used. If you have a young adult or a little older adult in the family who has tuberculosis, then it is a mandatory thing to get an IGRA tested for all the members in the family. The gold standard for us to look at having an active tuberculosis is to actually pick up the TB bacteria in the sputum sample, or else in the samples that we have taken it from, say, for example, a lymph node or a bone. These kind of places, wherever you feel is the symptoms, you'd go accordingly, target it, and pick up if there is a higher incidence of or risk of tuberculosis. Every patient of tuberculosis, we normally mandatorily do screen for diabetes as well as for HIV. So we have a latest thing which has been coming out from the government. I think Maharashtra is one of the Mumbai and Maharashtra is one of the cities wherein you're going to be having a BCG vaccination rollout program, which will be targeted for people above the age of 60. Because we have been given our BCG vaccines, or probably some of us may not have even received it, but this particular vaccine is known to, according to certain studies, reduce the incidence of bad tuberculosis in patients who are elderly. Taking a good amount of nutrition, a good supplement, adequate amount of outside air. When I say that, people who are generally cooped up within their houses and who do not have an activity in the form of exercise, exposing themselves to sunlight, obviously have a higher incidence of developing TB as compared to the other counterparts who are more active. If you're an alcoholic, refrain from doing that too often. Avoid smoking. Lifestyle interventions like diet restriction, caloric restriction, and taking an adequate amount of protein. These are simple things which might help us to pick up TB in individuals and manage to prevent that as well. So you have a National Tuberculosis Elimination Program, and we have something called a Nikshay Mitra programs. These are two programs which are coming from the government, works exceedingly well. So according to the National TB program, we have a set of areas which have been designated as TB centers, and medications are completely available free of cost. And mind you, the MDR treatment and the RR-TB treatment is best taken from these centers, because they do have certain drugs which are not available easily in the private sector. So this is one of the asks that we have for all our patients, to tell them that to enroll in the program, you can still stay with your primary caregiver, but at least get those medications from there, because those are extremely important. And because of the Nikshay Mitra program, there are patients who really can't afford the treatment, rather the nutritional support. These are also supported by the government of India. So while coming to the treatment protocols are pretty much standardized now. So you can't say that my treatment protocol is better than the others, because these are standard guideline-based ones. The difficulty for us when we give these medications to elderly is basically because of the toxicities that the TB treatment could cause. So there are multiple issues that it could cause, especially the anti-TB treatment, which are from the standard guidelines, could cause a problem for the liver. The ones which are the second line regimen, which is for MDR-TB, can have problems with your brain, with your skin, and so on. So the main thing is to handle these complications of the TB medication, because there's no other treatment protocol anywhere available in the world in any other pathy to really treat this. And to look at the polypharmacy. So if a patient is a diabetic and hypertensive, a heart disease patient with HIV, say for example, some amount of heart disease requiring many medications, then in that situation, you would have a difficulty in managing the drug-to-drug interactions. So here is where we really would want people to come up and tell us all the medications that they are routinely on, including the not including the Ayurvedic and the homeopathic prescriptions, because there could be a drug-to-drug interactions here, which you may think may not be significant enough, but which may be significant enough for your drug levels to go down substantially. So lastly, TB has no boundaries. We must all act together to eliminate TB in our country. Thank you so much.
Thank you very much, Dr. Mathew, for very detailed presentation.
Thank you, sir.
Thank you. Thank you very much. I'll just request you to stop the screen share.
Yeah, that's what I'm doing.
Okay.
I'm a little electronically challenged, so it takes me a little bit of a time.
No worries, I'm sorry. Okay. There'll be a stop screen share button somewhere.
Yeah, I'm trying to do that. Yes, got it.
So there's a question which has come in, and this is a question which has been asked by a doctor, okay, who is a general physician, who says, please ask doctor as to how many of patients, seniors especially, get bored of the medicines and stop taking them. And what do we do with them? Because we keep getting these patients with us and they just stop taking the medicine. And how harmful is this?
It's imperative that when we have started with medications, we continue with it. I think one of the ways that we can probably improve the compliance of taking medicine is by asking them to come in the first 2 months, every 15 days. Because that's one way to pick up a side effect of the drug, because we do ask them to do some blood tests and come back to us. And the second thing is, each time point that they come back to us, we also reiterate the need to take the medications on time, and if there are any complications of the same, to report back to us immediately. That's one of the ways that we can push them to take the medication. And the day that they come to us, spend some time with them and make it clear that their medication and your treatment protocols will last for a period of about 6 months. That's for normal pulmonary tuberculosis and for certain form of lymph node TB. So even if you're looking at something like a bone TB, it's a long haul. It's as long as 1 year to 1.5 years of treatment. So, holding their hand and taking them along is the only way that they will be taking the medications properly. Besides this, they will be having a caregiver. So there will be a family member who should be encouraged to come with them at every time point, so that it would be easier for us to touch base. Maybe also have a counselor in place, so that would also help them to understand the importance of continuing with the treatment.
Are the number of cases, doctor, that you find are they across all strata of the population, or is it something that is afflicting more people from the lower strata of society, the lower social groups, or otherwise?
So I do work with both the strata. So as I work in a medical school, so it's a lower strata, since it's a municipal medical school. So it's a lower strata that I see there. And whereas my primary practice, which is in Fortis, is with higher income group. Now, in both the groups, we do see that the numbers that we obviously see in a government hospital will be higher, basically because of the kind of place that they stay in and the kind of nutritional thing that they really have. But it's not as if we are not seeing patients in the higher income group. Out of every, let's say, 10 patients that I see, maybe 2 would be tuberculosis, 2 to 3, which is not a small number.
Every 10 patients you see, I'm just going to repeat it.
Every 10 patients I see in my OPD, since my practice is infectious disease, maybe that is the reason I see more of it. I don't do much of general practice kind of a things, but at least 2 or 3 would turn out to be tuberculosis.
That's a fairly significant number.
And
this is at a hospital like Fortis.
Yes.
So which means we're talking about, and let me just try and extrapolate it. We are talking about the higher socioeconomic groups as well,
Would have at least about 15 to 20% patients who are TB.
That's a fairly significant. And how many of these are senior citizens? I know your statistics were fairly.
I wouldn't have the statistics to really that, but let's say at least about 15%, 15 to 20% among that particular number. So say, for example, in a month, if I may be treating, say, for example, about, let's say I'm picking up 20 new cases, right? At least 5 or 6 from that would be TB of elderly.
Right. Doctor, one more question that I've come in is that I've received in advance was, and of course you've mentioned this, but I'm still, Doctor, I know of a case where a relative who had contracted TB, but she did not know about it for almost a period of a month. Why does this happen?
So precisely, as I said, by the time that you really get the major symptoms, it's already been couple of weeks, couple of months. You don't really have a major symptomatology coming in. So sometimes we just have a little bit of a sore throat, some glands around the neck. They may be brushed under the carpet thinking that it may be a problem basically because of the sore throat. But if that keeps on happening, and if you keep on happening to see that particular lymph node being persistent at a stay after, say, for example, a month or a month and a half, then you do know that it's not a normal kind of a lymph node. You should get back to the doctor. Most of the patients won't do it. If you have a cough which is persisting for about a month, we say anything more than 3 weeks, report back to the doctor. There are a lot of patients who don't come to us immediately at that particular time point. Not to say that every cough is going to be TB. It could be asthma, it could be anything else. But having said that, that needs to be evaluated. So more often than not, what we see is, you don't go to a doctor expecting the doctor to give you a good news. It's always a negative connotation to going to a doctor. So a lot of patients actually avoid doing that. They'll give me another 10 set of medications which I do not want to take. So a lot of it comes from both the ways. I mean, there are people who may be prescribing a hell lot of investigations. There are patients who do not want to take medication. So it works both ways. So as I said, if you have a drop in your appetite, you may consider it as a part of aging. And you may not consider that as significant enough. A low-grade fever, feeling a little down in the evening, may be again brushed under the carpet as something which is insignificant, not to be dwelt upon or, taken too seriously. By the time you take it seriously, it's month and a half, 2 months down the line. Sometimes each disease also takes a bit of a time to manifest in its true form. So each disease also requires a progression to come to that. So even those are reasons why you may not be able to pick it up at an earlier stage.
And what are the tests that one must do? Of course, going to the doctor is one thing, but in cities like Mumbai, for instance, one of the rare commodities, rare breed of people is the general physician. The family doctor has almost vanished. So, is there some test that one should do immediately?
So it all pertains to, sir, which organ system are we looking at? So if you have a cough, then maybe a simple blood test, a CBC, a ESR, and an X-ray might be helpful. But for every single little cough that you have, you do not need to get an X-ray done if it's more than 3 weeks duration. But when you have an X-ray done, you need to show it to somebody to be able to really evaluate. So that's something that would need to be done. If you have, as I said, lymph nodes, if you have abdominal tuberculosis, then without a consult, I would not be advising people to go ahead and do investigations, because those are quite a few investigations, including a scan, which might be required. And that wouldn't be done without a prescription.
Absolutely. Doctor, we have a question from Mini Gogia, who asks, what if the lungs get filled with fluid, which is not malignant?
So this is what we call as one of the extrapulmonary tuberculosis, called as pleural effusion. Now, this is a condition where, because of TB itself, you have a reaction in your lung, and that causes the fluid to accumulate. Now, this particular fluid will be associated with fever and the typical signs of TB. So normally what we do is to just take a part of the fluid and evaluate it with the help of certain lab investigations to pick up if there is any evidence of tuberculosis and treat it right. Now, our lady here probably meant it in general, but this is, I'm talking about TB related pleural effusion. There are pleural effusions which can be non-tuberculous in origin as well. Now, that would depend upon what are the patient symptoms and what are the patient signs that the patient has come in with, and what is the background disease.
Right.
So even heart failure can cause fluid in the lung.
We have a question which is, how does age affect the prognosis and recovery process for TB patients? Are people who are older than, say, 75, is it tougher for them?
Yes, as I did mention earlier, your immunity also undergoes aging. So your immune system is not as robust as what it used to be when you were younger. So your immune mechanisms may not be competent enough to kill all the TB bacilli, and so the whole thing might be a little more protracted as compared to earlier.
Right. Doctor, there's a question which is, I know you've addressed this, and these are perhaps not exactly what we are discussing today, but are there educational programs that caregivers and elderly individuals should be equipped with for on infection control and preventing the tuberculosis in a community?
So I don't think there are any really programs as such, but you could get in touch with your certain websites like WHO, CDC. These have certain links which are easily available. Mayo, Harvard, they have links which are available, which you could probably is for a kind of a public, where they give you some kind of an insight of what is to be done to reduce your risk of certain XYZ illnesses. So one could obviously get in, can kind of log into any of these sites and get the info. If you have a hospital, or if you have a primary caregiver who can probably come in every month and give some kind of an advice to the population, say, like as you mentioned earlier, there are a lot of places with assisted living. There are a lot of these community centers which are there. So like in the complex that where we stay, there we have people coming in very frequently. There is a senior citizens group which keeps on inviting doctors on and off. So these people come and give you the know-how of how it is that you need to reduce the incidence of, let's say, TB, diabetes, hypertension, cholesterol, what you need to do to manage your lifestyle, and so on. So a lot of these programs are happening in even corporate hospitals. So our hospital, for example, has a senior citizen group wherein they come every month, and there are programs which are run for them. And these are like CSR. So these work well, and there are no costs involved on both the sides.
Right. There's this question from an anonymous attendee who says, I had COVID in the second phase of COVID-19, and it was
2021.
2021 or 2020, perhaps. 2021, yeah. And it was a fairly long process of recovery. Am I among the high probables for getting TB because my immune system was already fairly compromised?
So the immune system compromised because of tuberculosis, because of COVID, would have put him at a risk for tuberculosis at that particular time point. Not right now. Unless and until we are looking at a damaged lung, in that case, the risk increases. So it all depends upon how much of lung still has fibrosis or any of the sequelae of the earlier infection. Otherwise, it's during that immediate time frame of COVID that you are at a higher risk of tuberculosis. Post that, it depends upon how much of lung has been affected.
How much of lung has been affected?
So that would be what we call as a sequelae in our medical parlance.
Doctor, there are quite a few vaccinations that are there for which have been introduced recently, whether it's shingles or influenza. Is there anything that one can take for tuberculosis at a later age?
So that's what I said. We are coming out with a program. I think tomorrow government will be announcing it formally, of giving BCG to people above the age of 60.
Right.
that is going to be helpful for with the intent that it is going to reduce the incidence of tuberculosis in that particular age group. So that's in the annual. And as far as influenza vaccine is concerned, pneumonia vaccine is concerned, I would really encourage people to go ahead and take it. It's not something that has come up recently. It's been there for donkey's years. The West has been doing it. We have been slow on the uptake of vaccines. I think the vaccine uptake has taken a boost post-COVID, thankfully. So that's something that people should do. That would reduce the incidence of lung infections in an individual.
And BCG, vaccination, even if one has had it, most of us have had a BCG vaccination.
We would have probably had it as a child, but then the immunity for the particular thing would reduce as you grow older. So this is to just boost the immunity and to see that your risk of catching an infection is lesser, and that you are going to be, more capable of fighting it out in case you do come, or if you do have a relapse of tuberculous bacteria in the body.
Now, I know we cater essentially to senior citizens, but can somebody who's just a 45-year-old also take a BCG vaccination?
So as of now, the rollout of the program is only meant for this particular thing, but technically, yes, even a 45-year-old would be in a position to take. But it would not, as I said, it's a government program, so it will not be available, over the counter. Be available only with the select, people who have been designated for the same. But we did have a trial during COVID with BCG vaccine, giving BCG vaccine as one of the as one of the ways to boost immunity against COVID. Yeah, so that we did for across all age groups.
And that did meet with some success, right?
Yes, it did.
It did, yes. But those days there was such a lot of news across various ways.
Yeah, it was all pros and cons, and there were a lot of things which were still a gray zone. But there's an article which has been published in Nature, one of the peer-reviewed journals, which commented that it worked well.
Doctor, we thankfully do not have too many questions today, which is of course a good sign that there aren't too many questions of people who are afflicted by it. But is there one final word that you would like to give to people, our readers, and people who are gathered here about tuberculosis in terms of those who have not got it, but just to be aware of their body and how does one ensure that one doesn't get affected by it? I know you've already said it, but just one.
Yeah, so my final take home is it's a disease which comes in when your immune system goes low. So we all know what affects the immune system. One is our basic health. I mean, you may be a diabetic, hypertension, whatever, as you grow older. So you need to keep that under check. Second is, do not forget that exercise is one of the main things even now as we grow older. So the more fit you are, the lesser likely that you will be landing up with an infection. Third is nutrition is important, extremely important. And it is important to have good nutrition. When I say good nutrition, it doesn't necessarily mean char roti khana. It will be reducing the amount of carbs and taking a good amount of proteins. For people who are vegetarians, like most of us would be, it is important that you have a good portion of pulses and lentils in your diet on a daily basis. Inculcate millet in your diet. If you're non-vegetarians, have eggs daily. So these are things that would keep you good. And more important, be happy. It's important. And happiness is also a state of mind which impacts your immune system. Fifth, and importantly, don't miss to show your physician or your family physician in case there are anything which are going to be protracted in terms of an illness for over 3 weeks, because that could be one of the indicators that something is going wrong in the body, not necessarily TB, but it could be anything at all. But go and show someone if you are unwell for a period of over 3 weeks. I think with that note, I would like to say that TB is completely curable. It's one of the diseases that when we were residents, we used to say, kuch hona hai to TB ho jaye. We'll at least come out of it. Right? So you don't have to, it's not a death knell like most of the other conditions like malignancy or, stuff like that has been there in the good old days. It is something which is completely treatable, completely curable. So don't get worried. Even if one does get unfortunately afflicted by it, we can still see the rainbow at the end of the day. Yeah.
Doctor, even as you were giving your final takeaway, there's one question which has come in. I'm not very sure how relevant is it. Can we have masks back to reduce TB?
So Here, I would say that if you are going out in an open environment, I don't see the reason why you should be masked most of the times. Whereas if you're going to an extremely crowded area, wear your mask. Wear your mask if you're going to a hospital-based setup, because there are patients who are going to be sick and ill. I mean, hospital is where you're going to see sick people. So in those places, one can wear a mask, but not 24 by 7. You don't need to be masked completely. As I said, I wanted people to go out in the fresh air, walk around. That's something that I would really encourage people to do.
So let me, digress and ask you a question. So if one goes to a cinema hall, is it something that you would advise
I
seniors?
do it myself, so I would advise so. There may be people who may say it's kind of foolish to do that, but as a practice, I use a mask whenever I go to a movie theater or some place which is completely enclosed. So that's something that we have been practicing, and we have been practicing wearing a mask for our OPDs right from the very beginning. As I said, we have been dealing with TB patients, so we prefer staying masked at that time. Point touch wood, with the grace of God, as of now, I've not had it. So I think that mask has been my protection.
So what you're saying is that masks are, and if you've kept it somewhere in the cupboards, etc., perhaps, it may not be
Look,
incorrect.
look at the expiry date and then use it.
Look at the expiry date if it does have one, but otherwise get yourself that, and at least in crowded places you must mask.
Crowded, enclosed places, because see, a theater doesn't have, it's an enclosed environment. So that's where you have a problem. I mean, as I said, if you go out in the open, I'm not worried. It's, you do have a fairly good amount of ventilation. So in these enclosed places, it's always a worry.
Enclosed places. Thank you very much,
Welcome, sir. It's
Dr.
been a pleasure.
Taking your time off on a Saturday evening and immediately after your OPDs. Thank you all. We will be back once again next Saturday, that is March 30th, for another session of Health Live at Seniors Today at 5 p.m. Once again, those of you who are who want to be there every week and who have not pre-registered, you can pre-register, and we will get in touch with you as soon as the session is fixed. You can also, of course, take maximum use of our Evergreen Club and all the various activities that are there. Next week, there's no Seniors Have Talent, but the finale is coming up on April 7th. So look out for it. And of course, there's the Seniors Today magazine, the last issue. You have seen the covers, which is a very special issue, which we have an interview with Sustina Ambani, and of course, host of our content, which is there. That's on seniorstoday.in, our website, and do look it up. Thank you very much again, Dr. Anita Mathew, for being here, and thank you to the team at Fortis to facilitate this. Thank you.
Thank you so much, and happy Holi to everybody in advance.
Yes, happy Holi to all of you.